Hi, this is Dr. Ty from Premier Orthodontics, and in this video we're going to tell you how orthodontists fix deep bites with braces. We'll go over 3 different ways that we fix deep bites and show you actual before and after photos of patients who had their deep bite corrected. So let's get started. So today we're talking all about deep bites. But as a reminder, we post braces related content on our channel every week. So if you're in braces or thinking about getting started, make sure to subscribe to see more videos all about braces. So most people may know that braces can fix deep bites, but most have no idea how it all works. But before we start talking about how to fix a deep bite, let's first define what a deep bite is. A deep bite, sometimes referred to as a deep overbite, refers to the top teeth excessively overlapping the bottom teeth. This picture is a good example. You may be wondering what excessively overlapping means. Well, generally speaking, an ideal overbite is when the top teeth overlap the bottom teeth by about 2 millimeters. So this image here is a good example of what we would consider an ideal overbite. So anytime a bite overlaps by more than 2 millimeters, orthodontists consider that to be a deep bite or a deep overbite. You may be curious why orthodontists consider a deep bite such a problem, because after all, it may not seem that obvious to people that the teeth overlap. The cosmetic look of a deep bite is less concerning to us. The real problem is what damage a deep bite can do to your teeth long term. As you can see in this animation, over time, if you have a deep bite, you will put excessive wear and tear on the front teeth. This can lead to damage, chipping, and the need for expensive restorative dental treatments down the road. Now, a deep bite is a common bite that orthodontists fix all the time, and how we choose to fix the overbite will depend on how severe the deep bite is. There are lots of ways a deep bite or deep overbite can be fixed, but we'll be discussing 3 methods we use at Premier Orthodontics when correcting deep bites for our patients. The first type of deep bite we'll discuss is a mild deep bite. The patient shown in this picture is a good example of a mild deep bite. You can see that his top teeth overlap the bottom teeth a bit, but overall they aren't too bad. You can imagine that if we were to put braces on his top and bottom teeth, he would actually have a tendency to bite on top of the lower braces due to his deep bite. So in order to correct this type of deep bite during the braces process, a combination of braces and bite pads would need to be used. Bite pads are small pads of dental composite that are placed on the top of the teeth to prop the bite open and allow the safe and stable placement of braces. And oftentimes these bite pads will be blue in color to make it easy for removal once braces are completed. You can observe from this photo that by placing bite pads, the patient will no longer need to worry about biting on the top of the lower braces. The back teeth are also separated by a small amount, and over time these teeth will gradually drift together. So by placing bite pads on the front teeth and allowing the back teeth to drift together, this is usually all that you need to correct a mild deep bite. These bite pads will typically be placed at the same time as braces and will be removed later on into the treatment once the bite is corrected. So with the patient we showed you earlier, you can see that his braces with bite pads help to align his teeth and correct the overlapping front teeth and fix the deep bite. Now the second type of deep bite we're going to discuss is a moderate deep bite. This patient shown in this picture is a good example of a moderate deep bite. You can observe that the top teeth overlap the bottom teeth by a large degree, and much more than our last example. For correcting moderate deep bites, we will usually use bite pads to separate the back teeth, similar to what we used in the mild deep bite correction, but in this case we will also use elastics to help pull the back teeth together. As you can observe in this photo, the back teeth are not touching when the bite pad is in position, and to help these back teeth come together quicker, we will ask the patient to attach a rubber band from the top teeth to the lower teeth in the back. This helps to pull these teeth down and to correct the deep bite. Additionally, if a patient has a more severe deep bite, a bite turbo may be placed in place of a bite pad. Bite turbos are similar to bite pads, but are usually placed on the front teeth instead. An example of bite turbos can be viewed in this animation. So this animation shows metal bite turbos being used, but at our office we generally use bite turbos made out of clear dental composite, so they're less noticeable. Like bite pads, bite turbos can be used in combination with rubber bands to help correct more moderate or severe deep bites. In the patient example we showed earlier, he was treated with bite pads, elastics, and braces. And you can see from his before and after photos, this treatment led to a great improvement of his deep bite. Now the third type of deep bite that we'll discuss is a severe deep bite. The patient shown here is a good example. As you can see from the photos, the top teeth overlap the lower teeth entirely. Additionally, the top teeth are actually biting on top of the lower gums, and the lower teeth are biting into the roof of the palate as well. So aesthetically, this doesn't look good, but functionally this can cause severe damage to the gum and palatal tissue, as well as damage to the teeth after enough time. To correct severe deep bites, we'll usually begin with braces, bite pads or bite turbos, and rubber bands similar to the moderate deep bite correction. This protocol will get us far into the process of deep bite correction, But if it's determined we need more bite correction, we may add a forceps appliance to help correct the deep bite. You can see in this animation exactly how forceps springs work. The forceps springs push the lower teeth forward and down and push the top teeth back and up, thereby correcting the deep bite. The patient shown before was treated with braces, bite pads, and forceps springs. You can see the amount of deep bite correction that we achieved from her before and after photos. So in this video, we discussed just 3 examples of how deep bites are fixed. There are lots of different methods and appliances, and the only way to know for certain which one would be best for you or your child is to have a consultation with an orthodontist. If you're living in the Phoenix, Arizona area, we'd love to see you for a 100% free consultation. At this consultation appointment, we'll discuss the best way to fix your deep bite and answer any other questions you may have. If you have any questions about deep bites, feel free to ask them in the comments section below, and we'll do our best to answer. If you found this information helpful, please give this video a like. Also make sure to subscribe to our channel for more braces related content, and make sure to tap that bell. If you want to learn more about why extractions are needed for braces, click here. And to see our most recent video, click over here. Thank you so much, and we'll talk to you soon.